Today, 1 out of every 4 New Yorkers does not speak English.
A lot of hospitals fail to provide adequate translation services. And what happens is people who are limited English proficient do not get the healthcare services that they need.
No one should be excluded from services in the city of New York simply because they don't speak English well.
What immigrants bring to a city like New York is life, vitality, energy, and resources.
It's a civil rights issue, it's an access to healthcare issue, it's a human rights issue.
Immigration now is a hot issue, especially like post 9/11. And there's a lot of focus on immigration, but not on immigrants as people and what their issues are. And I think that's a real disconnect, because when you're talking about immigration, you're talking about immigrants. And the immigrants as people are often ignored, you know, the human side of it.
En el Medical Center no hay intérprete hispano. Entonces el señor me ayudó, buscó la manera y vinieron a atenderme, pero ya era tarde, yo perdí la barriga por falta médica y de intérprete. Te dicen de allí, te dejan hasta 5 horas. Entonces yo no encontraba quien me ayudara. Ya a las 4 de la mañana, ¿quién me va a ayudar? Si eso está casi vacío. El que limpia fue que me ayudó. Es increíble.
The first thing we really need to do is raise community awareness about the requirements under the law and the obligations that the hospitals have. They actually have a right to interpretation and translation services under city, state, and federal law.
These people have been discriminated against by these hospitals. We want you to look at this problem and find a way to force the hospitals to comply with the laws.
Why haven't you been offering these services, providing these services to all New Yorkers? Why have you been locking out people who don't speak English well? Why does someone who is sick have to speak English well also to get help from you, even though they pay the same taxes that you do?
To this task of providing interpretation for every language of every patient, people say, well, isn't it impossible? No, it's not impossible. It's a challenge, but it's absolutely essential to having healthcare access for patients in Queens and in New York. You know, if we don't, what are going to be the consequences?